Hi, I'm Martin. I'm a second-year med student, and today I'll be presenting on Miss Dana West, who's a 42-year-old veteran female who presented to the office today one day post-operatively following incision and drainage of a right forearm abscess. She's especially concerned today that she may be developing a post-operative infection. She has a history of multiple infected abscesses like the one she has today before and has undergone more than 5 incision and drainages in the past. She states that her most recent abscess arose around 2 weeks ago. It started as an enlarging red pimple, which became more and more tender. She presented to the hospital yesterday, where she underwent incision and drainage without complication and was discharged with an antibiotic whose name she can't recall. Since yesterday, she's noted increasing redness, warmth, and a malodorous discharge from her wound, as well as pain, which she rates to be 6 out of 10 in severity, aching, and dull in nature. She says that she's had these symptoms before and was told that it's an infection, so she presented again today to make sure this was not going on. Today she complains of fever but denies any malaise, chills, or night sweats. Her energy level and appetite have been good, but she's not yet past flatus or stool. She states this is because she has not had the urge rather than constipation. The patient also confided to me that she is an IV heroin user around 2 to 3 times per week. She states that she uses needles but does not share, and generally uses alone without carrying Narcan. Her friends and family are aware of her habit, but generally don't spend time with her when she is using. Review of symptoms today. Generally, she is positive for fever but denies any chills, malaise, or sweats. Musculoskeletal, she denies any joint pain or swelling. She does have muscle pain and swelling. Dermatologically, she denies any itching or rash, but does complain of redness, drainage, and swelling. Cardiovascular, she denies any chest pain, shortness of breath, leg swelling, or arrhythmias. Respiratory, she denies any shortness of breath, cough, runny nose, or chest pain. Gastrointestinal, she denies any abdominal pain, constipation, nausea, vomiting, diarrhea. Past medical history is not contributory. She doesn't have any past medical history. Past surgical history, like I said, she has greater than 5 incisions and drainage without complications, but hasn't had any other surgeries. Medications, she's only on her post-operative antibiotics, which she can't recall the name of, no other medications. She has no known drug allergies. Her immunizations are up to date. Her family history is not very contributory. Her mom has hypertension, and her dad was recently deceased because of lung cancer. She does have one healthy brother, but doesn't really know anything else about any other family members in their history. Socially, she is a half pack per day smoker, but isn't really motivated or willing to quit. She doesn't use alcohol at all, and she's not sexually active. And like I said, she is an IV heroin user. She works as a mechanic, the trade she learned as a veteran, and her diet and exercise are fairly poor. She doesn't make any effort to do any exercise and generally eats mostly fast food or whatever food she could find. I did take a exhaustive kind of veteran history. She's an Afghanistan war vet. She served from 2010 to 2018, where she worked as an armored vehicle mechanic. She says that she transitioned to civilian life pretty well and is glad that she gets to do the same work here as she did there. She does say that there's a little bit of difference between the people she works with here versus overseas, but she has been able to adapt well to civilian life. She says that she doesn't really communicate with her military peers anymore, and she doesn't really discuss her military service with her friends and family. It's just not really a topic that comes up very often. She denies any service-related illnesses or injuries, and we talked a little bit about her relations with the VA. She does work with the VA, but specifically makes sure not to mention any of her heroin use there because she's afraid of judgment from the VA or being with. I did a short PTSD screening, and it does appear that she's positive for nightmares and flashbacks. We didn't talk much about that beyond there. And I also did a sexual assault screening, which was negative. Physical examination today. Vitals, she's a 5'7" female, weighs 160 pounds. Her blood pressure today was 112/68, which is very low. She's febrile. She has a fever of 101.6 degrees Fahrenheit. Respiratory rate is 18 per minute, and she's tachycardic with a pulse of 105 per minute. Generally, she's a well-developed female who appears the appropriate age, but she's a little bit anxious, and today she appeared fairly ill. Given our time and what we were focusing on, I really only examined her right arm, and examination of the right arm revealed a poorly healing surgical wound with surrounding erythema, warmth, and purulent discharge. She did have x-rays today. 2-view x-ray of the right forearm taken in the office demonstrated no acute fractures or dislocations. There wasn't any evidence of osteomyelitis or inflammatory infiltration of the soft tissue. I thought it was an essentially normal x-rays. So in summary, Dana West is a 42-year-old female veteran with a history of IV heroin abuse who presents one day post-operatively following incision and drainage of an abscess of the right forearm with increasing erythema, warmth, and purulent drainage over the last day and associated fever, hypotension, and tachycardia on exam today. Her problem list, I would say, number 1 is wound infection. She's also hypotensive, tachycardic. She has a fever. She has IV drug abuse. She has PTSD, and she's a smoker. Differential diagnoses, bacteremia and sepsis, possible disseminated endocarditis, possible disseminated osteomyelitis, PTSD, IV heroin abuse, and tobacco abuse. and assessment and plan for today. Given the patient's acute status, I think we should probably admit her to the hospital for aggressive fluid and pressure management of her hypertension. If she had cultures yesterday from her wound, we should manage empiric therapy with that. But if not, we can get wound and blood cultures in the hospital and change antibiotics as appropriate. And we can also manage her fever symptomatically with acetaminophen and call in psychiatry and surgical consult for possible irrigation and debridement of the wound and for management of her PTSD and substance abuse.